A note before we start. This episode contains mention of complex mental illness. From The Australian, here's what's on the front. I'm Kristen Amiet. It's Thursday, January 16. Prime Minister Anthony Albanese says strong action should be taken against people who perpetrate anti-Semitic attacks on Australian synagogues. But he won't back mandatory sentences for the offence or convene a national cabinet to tackle the nation's anti-Semitism crisis. That story's live right now at theaustralian.com.au. After days of negotiations, Israel and Hamas struck a ceasefire deal overnight. You can read all the details about the long-awaited agreement to end the Middle Eastern conflict right now at theaustralian.com.au. New mothers experiencing complex mental illnesses could be blocked from specialist psychiatric care in New South Wales as hundreds of psychiatrists abandon the state's flailing mental health care system. That's today's episode. Ariane Beeston remembers those sleepless nights with her son Henry well. He was waking up, as newborns tend to do, every 45 minutes, making her return to work after a stint of parental leave all the more challenging. But even in those hazy waking moments, Ariane felt like she was living a nightmare. She saw dragons everywhere, their apparent hunger for her tiny baby burning in their eyes. She doubted if the hands attached to the ends of her arms truly belonged to her. And she wondered more than once if her blue-eyed baby was the product of a mix-up at the hospital.
I experienced postpartum psychosis, which is a rare mental illness. It affects 1 to 2 in every 1,000 mums.
Ariane was admitted to a private mothers and babies psychiatric unit to help her manage the delusions and hallucinations she experienced following the birth of her son.
It was the only unit of its kind. It was critical for me to be admitted. I was experiencing quite severe side effects on the medications I'd been prescribed.
At the time, no such service was available in the public healthcare system. Instead, mothers and babies who couldn't afford to take the private route were typically separated during treatment. In the years since, Ariane's son Henry is now a thriving teenager. Dedicated perinatal psychiatric healthcare beds have been made available in hospitals across New South Wales.
The Australian clinical guidelines recommend that where possible, mums and babies should be admitted together. And what this allows is the opportunity for women, where it's safe and where they're able to do so, to really bond with their baby, to receive help, not just around their mental health, but also, settling and, feeding their babies and all of those things that can be really, really difficult when you're also experiencing a complex mental illness.
But now, New South Wales mothers could be without this vital care as some of Sydney's biggest hospitals close the few beds they have available.
First thing to say is that mental health disorders in the postpartum period are very common and will be experienced by between 10 and 20% of new mothers.
Natasha Robinson is The Australian's health editor.
In the most severe cases, that can include postnatal psychosis and relapses of severe conditions like schizophrenia and bipolar. And what this requires, given breastfeeding is involved, is very specialist skills and knowledge as to medication management for new mothers. And that's why it's really important to have care provided by specialist trained perinatal psychiatrists, of which there are very few in New South Wales and everywhere really. But in New South Wales, there's only sort of less than 20 of these specialists that actually exist.
There are just 2 mental health units comprising 16 beds in New South Wales, where new mothers can be admitted with their babies. And those beds are now being capped or closed for service altogether as the state's mental health care sector spirals into chaos.
A mental health system already under immense strain, and in days, 77% of the state's public psychiatrists will leave their jobs.
So there's only, in fact, 4 beds open at the moment, and the information from psychiatrists within those units and across the state from community mental health teams is that admissions are being denied out of area. So this really leaves people in regional areas in particular in a very bad situation because these units are supposed to provide care statewide.
Ariane is grateful that she was able to access this kind of vital healthcare via the private system, and she knows better than anyone why it needs to be available to other new mums, no matter where they live.
Not having access to these units means that women with complex perinatal mental illness need to be admitted to general psychiatric wards without their babies, which is hugely traumatic in an already really difficult time and a really vulnerable period for these women. So these units are critical. They save lives.
Of course, for the most vulnerable people and people who can't afford that care, they're left with no option. And for a long time in all states, including New South Wales, these new mums, breastfeeding mums, have been separated from their babies. So they're admitted to acute wards in public hospitals and they're not able to be with their baby, which is very, very devastating. But it also has profound impacts on the entire family and on the development of the child. And of course, the worst case scenario, if you can't even access an acute inpatient bed, and of course all beds will be under pressure across New South Wales if these resignations take effect, is that mothers can't access inpatient care at all in these dire situations. And that poses a fairly high risk to mother and baby. In fact, severe mental health conditions in the postpartum period are in fact a leading cause of death for these mothers and babies. So the stakes are very high.
Coming up, why hundreds of psychiatric specialists have handed in their resignations. Natasha, you've been covering healthcare for a long time as the paper's health editor. Have you ever seen anything like this?
No, I never have. And the state has never seen resignations en masse in these numbers. I mean, they're extraordinary numbers, 201 staff specialist psychiatrists making up a very large chunk of the workforce. And it really is just an indication of how parlous the state of mental health care is in New South Wales at this time.
By next Tuesday, the state's mental health care system could look completely different. More than 200 psychiatrists, half of the state's current cohort, are set to walk away from their jobs, citing concerns about pay and conditions they say are unworkable. Now, with just 5 days to go and no resolution in sight, the state and federal government's appeals to doctors to abandon their resignation plans have become more desperate.
Please don't do this. Remain at the table.
This was the plea made by Minister for Health Ryan Park in a press conference this week.
We can't afford wage increases akin to around $90,000.
What they're saying is, look, if we give a 25% immediate uplift in pay to psychiatrists, then every medical specialty is going to be coming to us wanting the same. So that is an understandable position, but no other specialty has 30% of its staff specialist positions vacant at the moment. No other specialty has an extraordinary staff exodus like this. No other specialty really has experienced the kind of spiral of decline that mental health care has amid record demand. Given all of that, there would seem to be a case that this is a special case. It's not just another industrial demand.
Natasha says the New South Wales government needs to decide if it's actually possible to run the state's mental health care system with next to no specialist psychiatrists on their books.
It seems to be an extraordinary proposition that you could do that. It will have knock-on effects, the government is admitting freely, and patients will be impacted. So is that feasible for a government to wear that and to have that on its record? That's for them to decide.
There's a bit of a misconception that hundreds of specialist psychiatrists in New South Wales are resigning because they're not paid enough. In reality, they say years of underfunding and under-resourcing has created a tinderbox. Doctors are exhausted and they're concerned vulnerable patients will pay the price.
This has been cast by the government as an industrial dispute. It's not really an industrial dispute. The reason that they're asking for this 25% immediate pay rise is to stem the tide of staff from the system, which they say is making the system unsafe. They feel as if they're now complicit in an unsafe system. They feel so desperate and concerned in terms of working within a system like that. So this is really the result of not just a disparity between the staff salaries that can be commanded in the public system versus the private and also interstate. It's also about decades of underfunding of mental health care, which we've, of course, covered very extensively recently in the Australian. I think it's fair to say it is at rock bottom at the moment. The system is on its knees, and it's really the morale that is just so bad in this system. They're feeling just battered and bruised within the system. It's exhausting. The culture in public health systems across the country is in a very bad way.
The need for specialised mental health care doesn't disappear just because the assistance is no longer there. So where does this saga end?
The reality is that most of these staff specialists that have handed in their resignations do not want to resign. These are people who are committed to the public system. They're committed to the most vulnerable patients. They wouldn't be in psychiatry if they weren't altruistic, if they weren't committed to care of some of the most disadvantaged people in our country. A lot of them don't actually know where they're going to go.
There are options for psychiatrists outside the New South Wales public system. There's academic or locum work, private opportunities, as well as work in other states and territories. But redeploying them as visiting medical officers or locums could end up costing the state just as much, if not more, than the pay rise they've requested.
But the reality is that by not having these people attached to the public system as permanent employees who are working not only on behalf of patients who they know, with colleagues that they know, but also contributing to the positive culture and the promotion of safety and safe systems within those public hospitals. If we lose all of that, it's a tragedy. It's very concerning for the safety of patients. It's going to have knock-on effects right throughout the system. But of course, in something like perinatal psychiatry, child and adolescent psychiatry, the whole system is under threat because there's not very many of these specialist psychiatrists. So what on earth are they going to do?
Natasha Robinson is the Australian's health editor. You can read all her reporting and analysis on the state of Australia's mental health care system anytime at theaustralian.com.au.